The hip is a large ball and socket shaped joint connecting the hip or femur bone to the pelvis. Injuries of the hip can be either acute or chronic. Chronic problems of the hip can cause pain to be felt at the outside area in the hip, in the groin or in the inner thigh, and sometimes down the leg or into the knee. The causes of these symptoms are usually either from injury to the structures inside the hip joint, intra-articular, or from structures that surround the joint, extra-articular. In some instances, hip and groin pain may be referred from your low back and spine rather than your hip. Hip pain can occur slowly over time. One of the most common causes of chronic hip pain is osteoarthritis. Osteoarthritis is a condition that affects the cartilage of the bone surfaces gradually, leading to symptoms such as stiffness, swelling, and pain around the hip. These symptoms can be more prominent after periods of inactivity, such as long car rides or waking up in the morning. It is worth noting that clicking or grinding sensations during movement can sometimes be due to arthritis. However, they can also occur in healthy joints. In some cases where the osteoarthritis is severe, joint replacement surgery is required and can have excellent outcomes. However, current best available evidence recommends several other treatment options which should take priority in the early stages. These options include a supervised exercise program, education about the condition, and weight management if applicable. These types of management plans aim to build up the strength and control of your legs, encourage correct movement through your joints, which is vital for optimal joint health, and create a plan for how you can successfully return to the activities that you love. Acute hip injuries are those that occur suddenly, usually due to high or abnormal loads placed through the joint. Examples of situations that may lead to acute injuries include a fall, twisting awkwardly, or being tackled during sport. In younger populations, injury to the hip is often a result of a sporting incident. This can be due to an unexpected tackle, increased training load or intensity without warming up correctly, or a sudden change of direction when fatigued near the end of a game or practice when you're tired. In older adults, a common injury is a fracture to the neck of femur. The neck of femur is located at the top of the thigh bone and is most often fractured as a result of a fall. This injury is considered a medical emergency and should be reviewed immediately by an emergency department. People are at greater risk of this type of injury if they suffer from osteoporosis, use medications such as blood pressure medication and sedatives, and if they are at greater risk of a fall. If you feel you may be at risk, a healthcare professional can help to identify and reduce these risks to prevent injury from occurring. This may include seeing a physiotherapist, exercise physiologist, or dietitian. Most acute injuries of the hip involve a strain to the muscles, ligaments, or tendons around the joint. Mild strains will usually resolve and heal within 2 weeks, while more significant strains or tears can take 6 to 12 weeks to fully recover. It is recommended that you use the RICER principle immediately following an acute injury, especially within the first 24 hours. Rest the joint, limiting movement. Apply ice for 15 minutes every 2 hours to reduce swelling. Apply gentle compression, such as compression bandage. Elevate the area above heart level to reduce the amount of swelling and pain, and refer by going to see your GP or physiotherapist for guidance and management. In all instances of hip pain, your GP or emergency doctor will be able to guide you regarding the extent of the injury and the management that is required. A physiotherapist will also be important for your assessment and recovery in order to manage your healing and symptoms, gradually building up your strength and control and developing your function so you can successfully return to the activities that you love. You will always be referred on to a specialist doctor by your GP or physiotherapist if required. For example, other assessments may be required, such as MRIs or X-rays. These are only used if a fracture is suspected, if the extent of your injury is unclear, or if further information is required in order to manage your rehabilitation. Another reason may be for a surgical opinion if it is deemed necessary.